On this wonderful Health Tuesday edition of Hello Nigeria. Now, don't forget, every Tuesday on the show, we look at health. We had to talk about stroke because Sunday was World Stroke Day, and Dr. Wahab Ahmed was very kind enough to come all the way from Osun State to educate us about it, and hopefully you took 1 or 2 points from that session. Now, we'll be switching gears right now and going on to another session. Now, when we mention this condition, many of you might think, oh, it's foreign, it's not for us. But by the time we start to talk about it, you'll realize that perhaps one or more people that you know have this condition. We are talking today about anorexia nervosa. Now, to speak to us about this is our guest who's been here before, and we're delighted again to host her, Dr. NESOCHI Okeke Igbokwe. And this afternoon, we'll be looking at anorexia in all its, well, as much as we can talk about in the next few minutes. Thank you very much
for joining us, Dr. NESOCHI.
Thank you for having me today.
All right. Now, I'm sure the big question, what is anorexia?
So anorexia is a very serious eating disorder that is characterized by a few things. So first, you would see a patient who has a very restrictive eating pattern whereby it makes them become extremely overweight, or underweight, pardon me. So they're very much so underweight. And the next thing that you'll see is that they have very much so an obsession or a fear of gaining weight. So they may exhibit certain behaviors to help them avoid any kind of weight gain, even though they are extremely underweight. So some of the things they might do, they may hide some of their meals, they may always run to the restroom afterwards to vomit sometimes, or they may even have laxatives or other medications to just try to get food out of their system, even though they don't even have any food in their system to begin with. Another component of it to be aware of is that these patients usually have very serious issues with body image distortion, whereby they may look in the mirror and although they're very much so slender, slim, underweight, they may perceive or see themselves as somebody that is obese or overweight.
So is this a medical condition or a mental health condition?
So it's kind of both. There's it's multifactorial. So there's a psychological component to it, and of course there's a medical component to it that puts one at risk for various medical complications. From not eating. From not eating, exactly. Exactly.
Right. So it leads to further complications, and this is where medical health comes, because like you mentioned, it's a thing of the mind. You see something in the mirror that is different from reality.
Exactly.
Right? A few pictures I've shown, and I can see the ladies looking very emaciated, very thin, and you're wondering why you're losing weight, and they're thinking, but I'm so fat. I mean, look at this.
That's a model.
Yes, and she's so skinny. Now, some people might think, no, it's not. So, we don't get that in Africa. In fact, African women like to be a bit, buxom, and is that changing? And why do women? What is responsible?
Why is it so particular to women?
Yes, yeah. and yeah, exactly. I even said why do women, because I don't know if men even have it.
So men can actually have it, but more so you'll see the condition more in the female population and more so at a younger age. So during adolescence or during young adulthood. So that's really when you'd see the onset of anorexia. And like I said before, it's really multifactorial. So it's a psychological component, and it's not really always just about the food. Sometimes it's a coping mechanism, an unhealthy coping mechanism to deal with some kind of stressor or emotional problem that you're dealing with. A lot of the times patients that do have anorexia, they also have other conditions such as depression, anxiety, and issues with suicidal tendencies as well. So it's a very serious condition in that regard. So the psychological component of it makes one believe that they have this body image that isn't there, this bigger body image that is not there. And of course, another important component to keep in mind is the social component. So when you talk about anorexia, especially in the social context, you really have to think about, I guess, the arena that people work in. So those that are in the entertainment industry, those that are athletes, exactly, models, actors, actresses. There's this huge pressure for them to basically look perfect in front of the camera all the time. So that can be a trigger for somebody in that field to try to always look perfect, be the best, and thinking or equating beauty and self-worth with being extremely thin.
Thank you very much.
So what are the symptoms of, how do you know a person is becoming anorexic?
Okay, so there are certain red flags that you're going to have to look out for when you think someone may be anorexic. But the first thing that you're going to notice is they become underweight. So somebody that you saw that was usually a healthy size before, all of a sudden, gradually with time, you see that they are extremely underweight. You notice some other things, such as them not wanting to eat food in front of you. So maybe you had a friend who would always eat meals with you, share a meal at a restaurant. Now you guys go out, they don't want to eat anything anymore.
Yeah, I can't imagine going out with Ayo and Ayo declining food.
And I decline, except I'm fasting. But with regards to, so apart from, so for parents, like you mentioned, adolescents, we have teenagers who are dealing with this problem. How can parents identify very quickly? Because sometimes they think they're just being moody, or they're not hungry, or they're worrying about something. At what point should parents start to get concerned, and how can they get help for these youngsters?
Okay, so there are more red flags that parents should be aware of as well. So if you notice that your adolescent child is now having this obsession or fascination with their looks, maybe they're now in front of the mirror all the time, looking at themselves, making comments like, oh, I'm so fat, I'm so big, I don't look beautiful. Or if you see them all the time, just, you notice certain behaviors like hiding food or just saying no to food. Those are certain signs that you will tend to notice, in addition to the fact that they are losing this weight, and also just the negative comments that they make about themselves. You're essentially going to notice a difference in your child's behavior from the way that they were before in the past. It's not going to be the same kind of person that they were before. Sometimes teenagers that have the problem, they tend to be socially withdrawn. So somebody who may have been very bubbly and energetic before, they can fall into a tendency to become depressed, withdrawn, and a little bit socially isolated.
What are the medical conditions that could happen if this is unchecked? What are the risk factors involved in not eating?
So when you're not eating, you're not receiving the nutrients your body needs, especially at that young age, to develop properly. So you're essentially in a low energy state. So some of the things that can happen.
And they're hungry.
They are hungry. Their body is needing that fuel and energy, but the psychological component of it tells them that they need to not eat, because if they're eating, it's going to make them fatter and what they perceive to be uglier. So they'll do what it takes to avoid eating at any cost. And they may also engage in excessive exercise behavior. So a normal person will exercise a few hours a week. They may spend a good majority of their day not eating and exercising for hours and hours on end, in addition to laxative abuse and other things, just to make them very thin. But the risks of that include extreme dehydration. When you're not having the proper nutrients in your body, you can become extremely dehydrated. Something else that can happen is an electrolyte abnormality, which just means certain things like your potassium levels, sodium levels, they're off kilter at this point. So you're at risk for having something called hypokalemia, low potassium levels due to this. Some of these things that can happen can actually put you into the hospital and require hospitalization, whereby you may need IV fluids, you may need correction of those electrolytes. Sometimes when it's so severe that someone is so thin and they're not eating anymore, sometimes it may require placing a nasogastric tube. Essentially, that's just a tube that goes like through the nose, exactly, forcing them to eat, because this actually is a condition that can kill someone.
Yes, I was going to get there, because some people might think, oh, it's people that don't have problems in life that will be doing nonsense like this, because in Nigeria we have hungry people who are looking for food. So when you look at someone who is not eating deliberately, it's almost like madness. And again, like Benga mentioned, it's important to highlight the fact that it's also a mental health condition.
Exactly.
Now, how can you talked about management of the condition. You find out that the person has this issue, we've had the medical response. Or how can people, once you've identified this, or you yourself know that you have this problem, how can you seek help? And what options are available to people like that?
Treatment options.
Exactly. Yeah. So there are various treatment options available. So the most acute thing that would happen, like I said before, is hospitalization. But that's for somebody who's at acute risk because they haven't been taking care of themselves, and it can lead to heart complications and dehydration and other things that I spoke about. But someone who is dealing with a problem in general, the first step would be to touch base with a psychiatrist, a mental health provider. Because what happens most of the time is something called cognitive behavioral therapy, kind of like a talk therapy. They talk through the problems to figure out what the underlying psychiatric issue is that's really inciting these things to happen.
Triggering that behavior.
Exactly, exactly. So that's one thing that's necessary. Another thing is that you would touch base with your primary care doctor, your medical practitioner, and they would do a whole panel of tests, blood work, just to make sure some of those electrolytes, all those other things that I spoke about were okay, and just to see where things are at baseline. The next thing that would be important is to have a nutritionist on board. So they would give you a good nutrition and dietary plan to figure out what is missing from your diet in general and how you're going to move forward. So it's really a multidisciplinary approach with a medical practitioner, someone that deals with mental health disorders, and a nutritionist as well. So everyone is part of this to help treat the patient.
All right. And do we have those facilities available in Nigeria? Because you talk about these things and it's like, oh, wow, where would I go to? Do we have such help available in Nigeria?
So I haven't seen many structured programs of that sort here in Nigeria, but always the first best step is to go to your primary care provider. Your general practitioner can help and guide you along the lines of where you need to go next, can link you up with that nutritionist to help you with the eating issues, and can help link you up with a psychiatrist to talk to help deal with the underlying psychiatric issues. And of course, when the condition gets too serious, if it's at a point where your life is at risk, then you may have to be admitted to the hospital to treat any of the acute medical issues, or may need psychiatric admission to treat any underlying serious psychiatric issues at that point.
Now, there are certain diseases and conditions that are more, that people of a particular race, like high blood pressure, stand a higher risk of getting. Does it have anything to do with race, anorexia nervosa?
So what we know about anorexia nervosa, that it's more predominant in the Western world. So you'll really see it more in the US, in Europe, but that doesn't mean that it precludes one from having this condition here in Nigeria. Anyone can really be at risk for it when you have that social pressure to look so perfect, depending on what field of work you do. That really can be a trigger. And you'd be surprised as to how many of your famous stars and singers and actresses and models here in Nigeria may be grappling with this issue. So it's not just a Western
Because there's a media pressure, a certain type of
course,
look.
Of course. So everyone wants to achieve that certain look. So some people will do whatever it takes at any cost to achieve that.
And even in the West now, I think they've started clamping down on extremely skinny models just to stop people from, there's a certain weight level that they look at as standards now.
I think that's really important. Thank you so much, Dr. NESOCHI. It's been such an enlightening conversation. And we hope that people at home who are watching can also testify that they've picked up 1 or 2 points from the talk about anorexia nervosa. Again, thank you, Dr. NESOCHI OKEKE.
Thank you for having me. Had a great time.
Thank you. All right, this is still Health Tuesday, but unfortunately, we will be closing the curtain on today's show in a moment. We're going on a quick break, and when we come back, we'll let you know what's happening today in history and then say bye-bye.
To enjoy more of these our Ogbonge videos when you just watch, press this button to subscribe on top of our YouTube page. You go love am.